Oh, go FM. Yes, say what the high Berekuso. Why? Munkacho Mampa no be kwama why?
We have respiratory tract infections, both adults and the kids as well.
Between 2003 and now, we've lost almost about 105 students. We apply on this road and look at the nature and state of the road.
This is the Berekuso Road. Commuting to and from school should not be this uncomfortable. But for these young ones in Berekuso, it is. Every day, pupils walk along this untarred stretch, bracing themselves for the next passing vehicle. When a vehicle approaches, they pause and cover their faces, knowing that once it passes, the dust will follow. Gabriel Maupemo says he is allergic to the dust and is worried about what constant exposure could mean for his health.
And you see, when the cars are going, the dust that comes straight, it comes straight to my eye. It makes it itch me. Sometimes I have bad eyesight at that time, and even inhaling it, sometimes I cough.
While filming, this woman approaches and insists she wants to speak.
Oh, go FM. Yes, say what the high Berekuso. Why? Munkacho Mampa no be kwama why? Go FM. Yes, Remo. Munkacho Mampa no be kwama why? Ni ye bread. It's even ya look mo. Ya yale. Yale o. Taizi fu. Want to na karasa. Taizi fu. Want to na kanasa. Yes, many bre pa. Many brankasa. Mesi ya high Berekuso yale papa.
At the Berekuso Health Center, which is the community's main health facility serving Berekuso and surrounding areas, health officials say respiratory-related cases are common.
Talking about conditions in relation to the nature of the road, we have respiratory tract infections, we have the bronchitis, the croup, the pneumonia, the rhinitis. We also have pneumonia and asthma cases coming in, both adults and the kids as well.
And there have been instances where there have been challenges in transporting patients during emergencies.
I recollect a memory or an occasion that happened way back in 2022 when a pregnant mother was in labor and we needed to transfer her to the regional hospital in Koforidua. I personally placed a call to the national. What they told me was because of the deplorable nature of our roads, they are unable to come. My director also put in her effort, my DDNS, but to no avail. So usually we rely on the local transport system, the taxi drivers, to transport patients to the nearby facilities or during referral.
Sterling International, a private school on the Berekuso Road, has had over 100 pupils leaving because of the condition of the road. Alfred Kojo Alote is the principal.
Yes, between 2003 and now, we've lost almost about 105 students. 105. Just within a term, they go out. Some will come in and go. By the twinkle of an eye, they are gone. And quite apart from this one too, we apply on this road and look at the nature and state of the road. There are issues of respiratory-related diseases that parents complain of, and eventually it leads to withdrawals. Parents would come in, we would do the admissions online, and the first time they drive on this road, withdrawals. So it's not been so easy for Sterling. If you look at our buildings, we have a capacity for about 1,000 students, but we are nowhere near even a third of that, just because of the withdrawals that we encounter.
Learners here share their own experiences.
At Actually, I don't live around here. I live around Kwabenya. So I have to commute from there to school every morning. And the bus gets spots easily because of the road. Sometimes it has potholes and it's easy for... This morning, for instance, we had a flat tire. So we got to school really late. Now the bus systems are really difficult to operate because of the road. And you can be on the bus. We are inhaling a lot of dust as we're on the bus. So we can be on the bus and we randomly hear 5 people sneeze at once. we all get sick sometimes. When the weather is cold as well, it can cause some of us to get so sick. Some of us are asthmatic as well. So it's really not a good thing with the current state of the road.
Due to the potholes and the dust, parents are not able to come and visit their children in the school. And when they come to visit, their cars mostly get spots on the way here and it gets dirty. So we would like for the government to fix the road as fast as possible.
From children covering their faces on their way to school, to a health facility managing rising respiratory cases, to emergency referrals complicated by poor access, the cost of this road is being counted in more ways than one. For Joy News, I am Peril.